Hi, my name is Payton Walters. I am a senior nursing student here at Bethel, and my presentation is called A Review of the Literature of Non-Hormonal Contraception, an Educational Guide. So this whole thing is centered around my PICO question, which is, in women living in underdeveloped countries, how does access to education on contraceptive methods, particularly non-hormonal forms of contraception, influence the rate of unwanted pregnancy? So just some background on non-hormonal contraceptives. The main one that I decided to focus on is called the standard days method. And the way that it works is that you have a necklace, which is pictured, and it has different beads that indicate when a woman is on her menstrual cycle, when she is fertile, and when it's safest for her to have sex and not get pregnant. So people that are compliant with the standard days method follow their cycle extremely closely in order to avoid getting pregnant. It's extremely cost effective. In the first year of use, it costs women less than $5 because they just have to get the necklace if they choose to, or it's become more popular nowadays to get an app and track on a mobile device as that becomes more popular. There are no hormones involved, so there are no side effects, which is a huge plus side. And it also gives women control over their body. They get to learn about their fertile periods, when it's safest to have sex, and it just gives them some control over their own bodies. It is extremely important that these women are completely compliant with everything. They have to know that periods of abstinence cannot be substituted with condoms. They have to be completely abstinent for the 12 days. And it's been recommended that they have monthly check-ins with their healthcare provider that they've chosen to speak with about this form of contraception. Again, they do use extremely careful tracking and make sure that they're on their cycle and not having sex during those times of fertility. But the biggest piece of forms of non-hormonal contraception is the education, which is our healthcare providers' role in all of this, because a lack of education has been linked to unsafe abortions and poor outcomes for women. So just a bit of literature review. It does have an 88 to 95% effectiveness when it is used correctly. But most studies and implementation have occurred in underdeveloped countries, as those are areas that do not have access to hormonal forms such as IUDs, pills, implantations, etc. So in Guatemala, it only costs $916,000 to implement, and that all includes integration, training, communication, coordination, policy and advocacy, and research. In India, it costs $671,000, and in Rwanda, it costs $2,718,000, which comparatively to other forms of hormonal contraception is extremely cost effective, and these costs do not affect the participants in SDM, but is more a taxpayer money type thing where it goes on the state instead of directly from the women. Barriers to forms such as SDM is that these women must have regular cycles. So if they do not consistently have 26 to 30 days between each menstrual cycle, it's less effective because it's harder to track when their fertility periods are. It is lacking some research, as most research is only available in underdeveloped countries. So women in more developed countries such as the US do not have the education on SDM that they may want or need if they don't even know what it is. And then there's a huge lack of education to women, their partners, and healthcare providers, because we as healthcare providers can't give this information if we're not educated on it in the first place. Some recommendations that I would have for future research would be focusing more on the effectiveness, necessity, and centering research in more developed countries. So possibly instead of just finding underdeveloped countries, finding those that have higher rates of unsafe abortions or lower rates of education on any contraception. And then maybe we should put more of an emphasis on the use of apps, because apps can be free and most people already have cellular devices or computers that they can track these on, instead of getting a necklace that could be harder to use or understand for them. And it's been highly recommended that attendance to monthly check-ins is mandatory for both partners, because when both partners are involved, compliance rates skyrocket. So it is recommended that both partners are present at all check-ins. In conclusion, with proper education and compliance, the standard days method of contraception is a completely reliable and appropriate form of contraception. Often, this is really the best or only option for women of lower socioeconomic status or people that are in underdeveloped countries that don't have access to other forms. So it really has become an opportunity for women to take control of their body, gain education on things that they may not have ever learned, but they should be aware of. Thank you.